next speaker, Dr. Madhava Diggavi, Professor, Government Ayurveda College, Bangalore, onto the stage. I also call upon the chairperson, Dr. Sudhir, Principal, Shree Varma Ayurveda College. A warm welcome, sir, onto the dais. I also invite Dr. Dharmesh to co-chair the scientific session. Please come on to the dais. I once again take the opportunity to invite Dr. Madhava Diggavi for the scientific session on holistic, patient-centered, integrative, collaborative clinical approach to male infertility. The stage is all yours, sir. Please come forward.
Hello. Om Shri Dhanvantare Namaha. With the permission of the chairperson, Dr. Sudhir, Principal of Shree Varma Ayurveda College, all the respected dignitaries and delegates. Deva Vaidyaya Vidmehe, Dhanvantare Cha Dhimehe, Tanno Deva Prachodayat. Ragadirogan Satatanushaktan, Aseshakaya Prasutan Aseshan, Autsukya Moha Ratidan Jaghana, Yo Apurva Vaidyaya Namostu Tasmai. With great salutes to the luminaries of Ayurveda, Charaka Sushrata Vagbhatadi Acharyas. Today, I am here to share few of the thoughts on male infertility. One of the important branch of Ayurveda called Vajikarana Tantram. It is not the question of treating the case alone. It is also a policy program, a collaborative research with contemporary science. As far as andrology is concerned, it is a branch where male patients are treated for their reproductive issues. The reproduction has got two phases. One is the sexuality, another is spermatogenesis. So spermatogenesis disorders are also going to cause problem to the couple. Our sexuality related dysfunctions also cause problem to the couple. When you are dealing with sexuality, there are no more objective parameters for research in any science. It is purely symptomatic. It is purely the action of penile corpora cavernosa, how erection is taking place. Erection and erectile dysfunctions are more of psychosomatic disorders. Of course, the sexology was a branch of psychiatry in the past. Later on, this department developed very well, and many times gynecologists used to treat the cases of male sexology. Later on, endocrinology and andrology have developed. Now, it is under the heading of andrology. Of course, some of the instrumentation and technology has been developed for assessment of erection failure in men. Erection is also talked about in women also. But today I'll talk more about male factor infertility. When we are doing a clinical male infertility case deals, we need some modern technology. Objective parameter based research requires collaboration and integration. Integration is in the thought, not in the cross practice. I want to be clear in this. Integration is not cross practice. Integration is exchange of technology and adaptation of objective parameters for male factor infertility. Male infertility, it is talked as many times In the area where I have worked, male patients do not come to the clinic voluntarily. They require a lot of pressure, compelling, then only they will come for evaluation. Otherwise, male has got an ego that he will not come for evaluation. But the incidence rate of male infertility is rising. There are so many reasons for that. One of the common causes for male infertility is smoking, alcohol, and bad lifestyle. Dinacharya, Rutucharya, Ratricharya are not followed. Vyayama is not followed. And moreover, Sahasa is more. Now, Sahasa has caused male to suffer with spermatogenesis disorders. Sahasa may be in any form. It may be wheeling, it may be bike riding, it may be regular exposed to over exercises. They all go to cause this issue. Recently, I have made a data that early exposure to sexuality and sexual feelings is a cause for male infertility. From the high school age, toddler's age, people or the adolescents are exposed to sexuality by any means. It was not true in ancient Indian times. Male and female were not together for a long time in the adolescent period. Now, due to the co-education or due to the friendly environment or fast society, early sexuality exposure is a cause for seminal decline. Decline in sperm quality and quantity is due to the stress factor in adolescence. In one of the study, it is documented that in the high school age period, if antihistamines are more prescribed, they will have low sperm count in their adult life. From the pediatric and neonatal OPDs, you can see that lot of antihistamines like montelukast is prescribed for longer period. When baby is suffering with cough, cold, fever, I have seen pediatricians prescribing more than 1.5 months of montelukast. Such antihistamine exposure in the childhood will cause low sperm count. I want to talk few technical terms. Shukra is semen plus androgen. Retas is semen and it is also called Rupa Dravya by Acharya Charaka. Bija is spermatozoa and DNA. Now I am working on DNA fragmentation studies more, where sperm count is there, motility is there, testosterone is normal, still they don't conceive, even with ICSI. It is due to the defect in DNA of the spermatozoa. The DNA, if it is fragmented, if it is fragile, if it is not intact, even though count and motility are there for somewhat, still patient will not conceive. And virya is testosterone. For male, virya is testosterone. There are a lot of causes for male infertility. One is neglected lifestyle or westernized lifestyle. Eating of fast food, junk foods, mineralized waters, eating of many times in a day. That is also a cause. Remember, in olden days, when I was a child, we didn't get food at any time 24/7. But now, because of the fast lifestyle, even at midnight, 2 o'clock, you will get all food. Whether it is Swiggy or any other group of services, you get all food at all time, 24/7. People start eating at 2 p.m. Recently, I had a patient. He has got a shift duty. He eat supper at 2 o'clock in the midnight. These lifestyles are going to cause male infertility. And juvenile exposure to sexuality, addictions, lack of human values. Parents and children don't have a bondage. In the metro culture, student or a parent and a child relationships are not good. And parental bija dosha. Parents are having some addictions. Nowadays in Bangalore metro, I am seeing both couple are smokers and alcoholics. When their bija dosha is there, the conceived material will suffer with male infertility in their next life. Acharya Charaka quotes in Rasayana Pada, Apatya Santanakaraha Yad Sadhyaha Sampraharshanam. What is the meaning of Apatya Santanakaraha? Chakrapani writes there, Putra Pautrasyabi Vajikaranam. When a couple take Vajikarana Chikitsa, that will be transferred to next generations. That is the potential of Vajikarana Chikitsa. If the couple have taken Shodhana followed by Vajikarana, their children and grandchildren will have Vajikarana effect. So if parents have got some Bija dosha, I have cases regularly we get, count and motility are very good, but they have chromosomal anomalies. Their genetic mapping shows some of the disorders. Ashodhita Bija Janya Garbha. I always postulate and pressure my people or my customers that before pregnancy, after marriage, both husband and wife must undergo Panchakarma Shodhana Chikitsa followed by Rasayana Vajikarana, and then only they should conceive. In Ashtangurudaya Sharirasthana, Vagbhata says, Tam Basti Shilitasya cha. Many bastis must be taken by male and then only he should conceive. If bastis are not given before conception, there will be DNA damages and infertility is an issue. Exposure to synthetic drugs in adolescence, anxiety and more liberty. More the liberty in sexuality or sexual practice, more will be the seminal disorders. No awareness, no dinacharya, no rutucharya, no rutu samshodhana, no rutu rasayana. In Varsha Rutu Basti Chikitsa, in Sharad Rutu Virechana Karma, and in Vasanta Rutu Vamana Karma. 3 important Panchakarmas are must for all adults or all people who are in the reproductive age. 3 times Panchakarma is required, and Rutu Rasayana, that is Sindutta Sharkara Shunti Kanamadu Gudaihi Kramat. Haritaki Rasayana 365 days according to the season must be practiced by male and female. If it is not there, male infertility is going to happen. Last is very interesting. Narina Marasagnata, Stri Dosha Darshanat, Vyoni Gamanat. 3 important hetus detected at the time of Charaka is Narina Marasagnata. Why people are male infertility sufferers? They don't understand the wife. They misunderstand the female partner. They misunderstand the spouse. This is told by Acharya Charaka, not today's concept. At the time of Charaka also, male were not understanding female. There is no mutual understanding. That is one reason. Second is Stri Dosha Darshanat. Finding faults again and again in the wife will cause male infertility, not the female infertility alone. Finding faults in wife will cause the androgen receptor activities are negative, so that there will be male infertility. And lastly, Vyoni Gamanat. At the time of Charaka Samhita, the unnatural sexual practices, sodomy, or animal sexual intercourses were practiced, and in my one of the data I have noticed that in one of the group of people, they had animal sexual intercourse and they suffer with autoimmune male infertility. Anyone who have excessive masturbation, sodomy, homosexuality or cross animal sexual practice, they will suffer with autoantibodies in semen, and due to that autoantibodies, the immunological infertility develops. There is one rule for PC-ICC approach to the male infertility. This is why I want to focus in policy makers. This is one model to do integration. What is this is, the patient should have evaluation with general history, Reto Pariksha and Shukra Bija Pariksha, then CASA, computer assisted semen analysis, on which we are working. It is a WHO standard semen analysis protocol, DNA fragmentation index, and testosterone, FSH, LH, prolactin, AMH should be tested. Nowadays I am getting a lot of cases where male patients are having AMH low levels. Anti-Mullerian hormone is low in male. Anti-Mullerian hormone excess in female causes PCOD and infertility. Anti-Mullerian hormone decline in male causes male infertility. So scrotal ultrasound, penile Doppler, transrectal USG, testicular biopsy, semen culture and sensitivity studies, anxiety, depression scales. Many of the people are having anxiety, depression. So anxiety, depression scales must be used to denote or diagnose male infertility. There is one model for male infertility where I propose like this: modern and Ayurveda diagnosis, Ayurveda treatment and modern assessment. This is the integration approach for male infertility. Do Ayurvedic diagnosis based on Shukra Pariksha and Reto Pariksha, modern semen analysis and computer assisted semen analysis with hormone evaluation, and then Ayurvedic treatment alone. Whenever treatment comes, we should do only Ayurvedic treatment. Since past 3 decades, I am not doing any cross practice, more focused on only Ayurvedic Chikitsa. Treatment should be Shuddha Ayurveda, but diagnosis should be based on Ayurveda and modern, and evaluation and assessment should be based on modern and Ayurveda again. This is one model. Then Ayurveda male patient case before IVF or before assisted reproductive techniques. Now my work is done like this. I prepare male patients, I treat male patients, and we make their parameters normal and send it for assisted reproductive techniques. Before going to IVF, treat the male patient, make him ready, make all semen parameters and endocrine parameters normal, and send it for IVF. Success rates are good. Success rates are also good. And Ayurveda treatment with Shodhana, Uttarabasti, semen processing and assisted reproductive techniques. I prefer Virechana and Basti is a must for male infertility cases, no shortcuts. Shortcuts will not give you always success. So thorough Virechana karma with Purva karma, Pradhana karma, Paschat karma, no shortcuttings. Someone tell one day Snehapana, one day Abhyanga and one day Virechana, one day Basti. These sort of short cuts will not give results in many of the cases. Second is followed by Uttarabasti. Uttarabasti is transurethral administration of medicaments. We administer through penis, we administer medications, and after that, semen processing is done. Semen processing is to improve the semen motility and quality, and assisted reproductive techniques are done. Vajikarana therapy followed by IVF and DNA fragmentation index. Whenever DNA fragmentation index is above 26% and above is positive DNA fragmentation index. In that, I follow this protocol, Shodhana, that is Virechana and Basti, Rasayana, Vajikarana, Uttarabasti. And if naturally not conceived, then patient can go to IVF treatments. When scrotal varicocele is there, I usually treat grade 2 scrotal varicocele without surgery. Grade 2 varicocele is reversible. With Virechana, Basti and Uttarabasti, varicocele can be reversed and then the patient will get improvement in motility. When varicocele is there, there will be motility hampered. Due to the varicocele, scrotal temperature rises and motility comes down. In that case, we do Virechana, Basti and Uttarabasti, then Rasayana, Lepa, and we have seen that 3 consecutive Jalokavacharana over the scrotum will reduce the grade 2 varicocele to normal. Then we further progress for either normal conception or IVF or IRT. So, Shukranu is, or spermatozoa is a special cell. It has got a head, midpiece and tail. Head is having heaviness, midpiece contains mitochondria and tail is flickering movement. You can see the spermatozoa goes to the cervix mucosa and after passing through the cervix, it will go to the fallopian tube. In the fallopian tube, in the cornu, there will be conception. With conception, it will come back to the uterus and then gets nidation, fixing. Spermatozoa is a structure. I correlate head, midpiece and tail. 3 parts of the spermatozoa are there. This is one spermatozoa is enough to enter the zona pellucida and cause conception. Acrosome and mitochondria are the energy house of spermatozoa. It is Pittasthanam. DNA nucleic material is there in the head and it is Kaphasthanam. Tail is responsible for motility. It is Vatasthanam. When head abnormalities are there, it is due to Kaphaja Shukradushti. When midpiece abnormalities are there, it is due to Pittaja Shukradushti. When tail abnormalities are there, it is Vataja Shukradushti. If you know Kapha Pitta Vata understanding at the level of spermatozoa, then it is easy to handle with Ayurveda. When Kaphaja Shukradushti is there, I use Bhallataka Rasayanam. There is one beautiful stall in this expo. IMCOPS prepares very good Amruta Bhallataka Leham. I have tried many companies Bhallataka Rasayanam, but that company from Chennai prepares a very good quality Bhallataka Rasayanam. It is a Ekamulika Rasayanam that is effective in Kaphaja Shukradushti, head abnormalities, when DNA nucleic materials are abnormal. When midpiece abnormalities are there, it is Pitta Dosha Shukradushti. Usually, Sariva Chatushka Prayogam I do it. Sariva are of 4 categories in Western Ghat. I use 4 types of sarivas which are available, and sariva with Rajata Bhasmam is effective in mid-piece abnormalities. For tail abnormalities, I use many of the drugs which are effective for Vata dosha. There I use Makaradhwaja Rasayanam and Chandrodaya Makaradhwaja Rasayanam, along with any of the Rasayana Chikitsas which are good for male patient. It is one interesting topic to note that Maharasnadi Kashayam is indicated in female infertility. Chavanaprasha is very good for Reto Dosham and Pum Dosha Haram. For semen disorders and oogenesis disorders, Chavanaprasham is told. Chandraprabhavati is also one such molecule where it is given to both male and female. Chandraprabha is also male infertility and female infertility indications are there. Then the student may raise a question, for male and female, why same drug is given? Is it scientific? You go to modern gynecology practice, clomiphene citrate 25 mg for male, clomiphene citrate 50 to 150 mg for female. Same medicine is given for oogenesis, same medicine is given for spermatogenesis. Chandraprabhavati contains 2 ksharas and 3 lavanas. And it contains Loha as well as Shilajitu and Guggulu. Actually, Vatti should not be the name for Chandraprabhavati. Actually, Chandraprabha Guggulu should be the name. Because Ashtakarshau Shilajatuhu, Ashtakarsha Matram, Guggulu is the manufacturing methodology of Chandraprabhavati. 8 Karsha of Guggulu and 8 Karsha of Shilajitu is there in Chandraprabhavati. Without fear, write Chandraprabhavati from first day of infertility consultation until the patient conceives. It may be 1 month, 2 months, 3 months or 4 months. Kalyanaka Grutam, Maha Kalyanaka Grutam, Panchagavya Grutam, Maha Chaitasa Grutam and Dadimadi Grutam. You know, Government of India has banned Pumsavana Karmam. Male and female differentiation cannot be done. But in my one of the clinical trial, I will show you, clinical case series I will show at the end, where we have seen that 50% of the people who received Dadimadi Grutam have Pumsavana effect. 4 children were born to 4 couple, 2 were male and 2 were female. So, Dadimadi Gruta Falashruti says, Pumsavanam Param. You need not do Pumsavana Nasya Karma. If you administer Dadimadi Gruta in the antenatal period or prenatal period, patient will get the male babies itself. The diagnosis of male infertility is based on modern parameters. Here I want integration. Without modern investigation, if you do treatment, if at all something goes wrong, another allopathy doctor will diagnose and tell that Ayurvedic drug has caused a motility disorder. That's why before treatment, do general physical examination, semen analysis, scrotal ultrasound, transrectal ultrasound. In my life, I have seen only 2 patients where vast difference is absent. There is no vast difference, but testicular spermatogenesis is present on fine needle aspiration cytology. So, when there is no spermatic duct, it cannot be diagnosed by USG abdomen or scrotum. It can be diagnosed by transrectal ultrasonography. Then hormone testing, post-ejaculation urine analysis. Some of the people don't ejaculate when they do sexual intercourse, but after sexual intercourse, when they do urination, then semen will go and semen will pass. This is retrograde ejaculation. This is Vimargagamana of Shukra. And then in such cases, post-ejaculation urine analysis is effective. Why to perform semen analysis? This is the integrated approach where semen analysis will tell you lot of information for male infertility. It will tell about the fertility rate, it will tell about the suitability of semen for artificial insemination, it will tell about surgical causes, it also tells about success rate in male infertility. How semen analysis is done? In short, I will tell you 3 days after the sexual intercourse, patient should go to the semen analysis lab, and after collection of the semen, within 20 to 30 minutes, the semen should be examined, and macroscopic and microscopic studies are done. After macroscopic, spatigabam, dravam, snigdam, maduram, madhugandhita, shuklam, icchanti keshittu, tailakshodra nibam sada. The normal color of the semen is like a honey or oil color. That color semen is very effective, and if I have seen in the last 2 months, many people come and tell that, sir, my semen is watery. Watery semen is not having Pichila guna. Pichila guna is due to viscosity of the semen. Fructose and viscosity will give thickness to the semen. If semen is watery, Bhaishajya Ratnavali says Shukra Taralyam. Shukra Taralya is a condition where Apmahabhuta is increased in Shukra Dhatu. So Shukra Dhatu contains less Guru Guna, less Prithvi Mahabhuta and more Apmahabhuta. I remember and I dedicate today's my talk to my senior and my mentor Dr. L. Mahadevan. We used to talk about this. Pancha Mahabhuta and Guna analysis at the level of Shukra is also possible. Based on that we can make semen analysis is one good parameter to make an integrated approach. This is computer assisted semen analysis lab we have established. It costs about 30 lakh rupees for establishing the lab and 28 lakh rupees for CASA software. It's almost 60 lakh rupees, and only Ayurveda government college having in India is Government Ayurveda College Bellary, where government has sponsored by disease fund we have developed this, and not even all medical colleges have this facility, where it is a WHO certified parameter for integrating male infertility, where my PG scholars are working on these semen disorders. We perform semen analysis before and after treatment, and lot of clinical success stories have been developed in this. In macroscopy, liquefaction is, after semen is collected, it becomes dissolved. That is called liquefaction. If liquefaction doesn't take place in 30 minutes, it is Kafaja Shukradrushti. Viscosity is thickness of the semen. If it is high viscosity is Kafaja Shukradrushti, low viscosity is Vataja Shukradrushti. Volume is less than 1.5 ml of semen is low volume. Color should be spatikabam, turbidity and pH. Semen pH should be 7.2 to 7.4. If it is more than 8, it is alkaline semen. Vataja Shukradrushti. Microscopic count, motility and morphology. These are three important integrated parameters: count, motility and morphology. Count should be minimum 15 million per ml. Motility should be 40 to 50% per ejaculate. And sperm morphology 4% can be abnormal, 96% should be normal. Sperm kinetic studies and aggregation and agglutination studies, RBCs in semen. I have seen in the last week, one of my patient came, he gave semen sample from the lab. I got a call that his semen contains blood. His semen contains blood. It was a red semen. We cannot do test. Again send the patient. We sent after 1 week. Again also there is a red color semen. Blood is there. And then they said, sir, you treat the patient for 1 month and then send back. Otherwise our microscopic study will be abnormal. This is integration. What is this blood mixed semen? Blood mixed semen according to Acharya Charaka is Anya Dhatu Samsrishta Shukradrushti. Out of 8 Shukradrushti, Anya Dhatu Samsrishta is blood mixed semen. RBC is present in the semen. This is one of the agglutination of the spermatozoa. If you see in the microscope, the sperms are attached one to each other. Head to head they are clumps. Tail to tail there is a clump. Tail to tip come and mixed clotting and tangles. The sperms are connected to each other. This is Kafaja Shukradrushti. Agglutination is a immunological infertility where people are suffering with, when sperms are agglutinated, clustered, they don't conceive. When clustered spermatozoa are there, they don't conceive. See, this is the normal head, mid-piece tail of the spermatozoa. In the right side you can see the spermatozoas, there is no tail, big head, small head, pin head, oval shaped head, irregular head, short head. In the second column, you can see the head and mid-piece abnormalities are there. In the last, tail abnormalities are there. You can see in the microscope, we have seen that double-tailed and short-tailed, tail is coiled. All these are semen abnormalities, sperm abnormalities. I have made one clinical new data all over India. It is the only one study doing on semen proteins. Semen contains 1350 proteins. These 7 proteins are responsible for quality and quantity of the sperm. If semen proteins are abnormal, 33% of the semen proteins are responsible for spermatogenesis defects, 13% are responsible for sperm metabolism. See the word, sperm metabolism. Shukra Dhatwagni is the sperm metabolic activity. Semen and sperm have got Agni. Agni is a metabolic phenomena. Sperm metabolism is abnormal, then they don't conceive. Though spermatozoa has got an Agni, if you are able to increase that Agni by means of using drug like Makaradhvajam or Rajata Bhasmam, they improve the sperm metabolism. Sperm motility is due to 30% of proteins. Sperm capacitization. Sperm is there, it is not having a capacity to penetrate into the zona pellucida. Then also spermatogenesis is there, but sperm capacitization is not there. Sperm capacitization is Virya Vardhaka Rasayanas in Ayurveda. Whatever the drug says Virya Vardhakam, Viryam Vardhayati, they are all sperm capacitization promoting drugs. and acrosome reaction 20%, and sperm egg interaction. There are receptors on the spermatozoa, receptors on the ovum. If the ovum receptors reject the spermatozoa, then there is autoimmune infertility. Infertility is an autoimmune disorder, infertility is a immunological disorder, infertility is a metabolic disorder, infertility is a disorder due to the daiva, due to the God's misgrace or God's effect. Then also there is a spermatogenesis disorder. So, line of treatment for male infertility, what I follow since past 3 decades is firstly Virechana, then Basti, Uttara Basti, Shukra Shodhana, Shukra Janana, and Vrishya Rasayana. If you follow this set of treatment for 30 days to 90 days, usually male factor becomes normal. So Virechana is given with a classical guideline: Mahatikta Gruta, Ashwagandhadi Gruta, Dhatri Gruta, Dadimadi Gruta, Tiktakam Grutam, and Mahapanchagavya Grutam. If you don't know anything, write Mahapanchagavya Gruta to both male and female. Mahapanchagavya Gruta is one of the powerful product to clear all defects in male and female. So Mahapanchagavya Gruta we use, it is a cow product. All 5 products of the cow is used for Panchagavya Gruta. And for Virechana Yoga, lots of drugs are there. We use Nimbamrita Yeranda Tailam, Trivrut Leham, Abhayadi Modakam and all. Uttarabasti in male. Uttarabasti is a special treatment protocol for male infertility patient. We do intrapenile Uttarabasti, intravesical Uttarabasti, intravas difference Uttarabasti is under trial. Uttarabasti, the definition according to Ashtanga Sangraha, it is Niruhad Uttarena Diyate iti Uttarabasti. And in Uttarabasti, this is the gunas of Uttarabasti. All Shukra Dushti, Shonita Dushti, and erectile dysfunction, Mutraghatam, Yoni Vyadim, all Shukrotsekam, all reproductive disorders are treated with Uttarabasti. This is in short my outcome of what are the medicines used for male Uttarabasti. In case of Oligospermia, I use Ashwagandha Tailam, Murchita Telatailam, Mahamasha Tailam. In case of Asthenospermia, it has come to end. I'll show the clinical trial and finish this. And in case of oligoasthenoteratozoospermia, we use Kshirabala Avartita Tailam. In azoospermia, Pipalyadi Anuvasana Tailam. In erectile dysfunction, Ashwagandhadi Tailam. So this is before the Uttarabasti, we clean the local area. Then Uttarabasti is done. In short, we can show you the Uttarabasti actual procedure. We do it in a major operation theatre with all sterilization methods. This is integration. Using modern operation theatre for Uttarabasti is integration. Not giving steroids or modern drugs is integration. So when patient is clearly done with painting, for painting I use the betadine solution, that is also integration. For disinfection we use betadine solution, that is integration. After that we wash the local genital area, then we cover it with a green towel, then a rubber catheter or a feeding tube is taken and slowly it is introduced into the urethra, and then the medicine is administered 40 to 50 ml or average 45 ml of medicated drugs like Ashwagandhadi Grutam, Ashwagandhadi Yamakam, Mashabala Tailam, Kshirabala Tailam, Avartita Kshirabala Tailam, Ashwagandhadi Yamakam, they are all used in Uttarabasti. When Uttarabasti is done, we have done a trial. Directly if you do Uttarabasti for 3 days, there is no result. If you do Virechana, Basti and then Uttarabasti and then Rasayana Vajikarana, then results are encouraging. We use the sterile feeding tube of 8 mm size. It is used for using Uttarabasti procedure. And in Uttarabasti we have observed that once you give Uttarabasti, it can be given after breakfast or after the lunch or after the afternoon, 2 to 4 p.m. also we can give. Uttarabasti is done in a OPD procedure. Patient will be given Uttarabasti and sent to his routine work, and he can have 2 hours rest. The simple work can be done. After 2 hours, the medicine which are introduced in Uttarabasti will come out. After that, he can have normal water drinking or tender coconut drinking. And when you are passing the catheter, it will go for 21 centimeters into the urethra. It will go to the male genital tract. Dashangula or Dwadashangula is the Basti Netra Pramana in male. So that much long catheter is passed into the Uttarabasti Netra. And in Uttarabasti, when you do any infection protocol is not maintained, operation theatre protocol is not maintained, urinary tract infection is very common. So in my clinical, I am administering a feeding tube. It is very thin. It is passed in. I don't use any local anesthetic gel. Directly the catheter is passed. It will go for Dwadash angula. Then we inject the medicine and patient is sent out. So after the Paschat Karma, you see, after the Uttarabhakti, he should take Yusha, any liquid diet. In the clinical trial, I'll tell, this is one first patient. He was having sperm count only 14 million and motility 30%. And second patient, he was having 14.5 million and 21% sperm count. The right side is our CASA report from the government hospital, free of cost. And the third patient was having only 4 million and motility was 0. And fourth patient was having 0.56 million and motility was 33%. These patients were given Virechana, and after Deepana Pachana, Mustadi Gana Kashayam from Ashtanga Hridaya was given, and then Virechana, Niruha Basti was given, and after Uttar Basti you can see the outcome. In the patient 1, sperm count improved from 14 million to 40 million, second patient 4 millions to 60 million, third patient 14.5 million to 20 million, last patient 0.5 million to 20 million. Motility improved also, and the morphology improved. See the last line, all female partners, all 4 partners, female patients were normal, all the 4 patients conceived and all of them delivered. So this is the sperm. 3 patients were delivered at the end of 9 months. Out of 4 patients, 3 photographs are there. One has not sent the photograph of the baby because of their myths, social myths. They said we will not give the photo of the baby. So 3 photos are there. So Shamana Rasayana given for all 4 patients is Kapikachu Ganavati, Swarna Vasanti Malati Rasa and Bhargava Prokta Rasayana. Bhargava Prokta Rasayana is Charaka Samhita, Vatavyadi Chikitsa Adhyaya. Single drugs like Ashwagandha is direct testosterone promoting. Shatavari is a powerful sperm count enhancing drug in male. Shatavari is not a female drug. Shatavari is also a male drug. And then Kokilaksha Bijam. Kokilaksha Bija increases the viscosity of the sperm. Gokshura is a direct sperm count and motility enhancer. It is a testosterone-like drug. And Mushali is also a very powerful drug to enhance the spermatogenesis. Vidarikanda improves the testicular germinal epithelium. Kapikachu and Estimadu are rasayanas which are very effective in the management of male cases. So single herbs or grutakalpas or any compound drugs can be used in practice. Mushali is a very powerful drug which has got a high market in the South India, where South Indian Mushali is very effective. One more drug I use in male infertility is Kusta, Sasura Lepa. From Chennai sample is very good for Kusta or Sasura Lepa. This Kusta is also having spermatogenesis enhancing action. So to conclude my talk, male infertility is one of the area where Ayurveda can do a very good practice. Integration is required in technology and Ayurvedic practice, where you can get very good money, name, fame and all. IVF centers and Ayurvedic Vajikarana Chikitsa should be integrated. In IVF center, Ayurvedic doctor should do only male treatment, and after the male treatment they can go for IVF or any assisted reproductive techniques. And usage of classical treatment of Virechana, Basti, Uttara Basti and Rasayana Vajikarana Chikitsa are very effective. Without doing cross practice, if you stick on to male infertility specialty clinics, anybody can do. Even simple BMS graduate can also develop a very good Vajikarana centers in metros. Metros are good areas for conducting male infertility clinics. With this, I am thankful to all the organizers of this Expo 2026 Conclave. And I am thankful for giving me an opportunity, and thankful to Ministry of Ayush for encouraging such knowledgeful events in various parts of India. Thank you. Namaste.
Thank you, Doctor. That was a very insightful session. Thank you for sharing your knowledge with us. Any feedbacks from the chair or co-chair on the scientific presentation? 1 or 2 lines would be helpful. Yes, sir, please.
Hello. Good afternoon, audience. holistic, patient-centric, integrative, collaborative clinical approach in male infertility, presented by Dr. Madhava Diggavi, sir. That subject was very good and informative. Along with that, I'm a Shalakya person, not a KC person, but even though I do GP. So, one or two points I want to add is actually, sir has told like modern diagnosis followed by Ayurvedic treatment, again modern assessment for the improvement of result. That is quite natural and that is a good approach. But the problem here is actually this Ayurvedic treatment, that is the biggest challenge here. Because what happens is, according to Vagbada, actually what happens is your Shukla Shonita doshas are mentioned like Vada Adi Kunavagrindin, Puya Kshina Malahoyam, Bija Samartham Redasram. So these are the Shuklartva doshas which is mentioned. But how many of we are going deeper into that and analyzing it? We call about Kashtartvam, Nashtartvam, all those things. All these terms are not mentioned by any Acharyas. So you have to either bring these headings into Vadadi, Kunaba, Grindi, Poya, Kshinam is there, Kshina Shuklam and Kshina Artavam. Okay, so if a patient comes with a motility loss or count loss, it should be considered as a Kshina Shuklam. So then how we are going to approach it? That is the next point actually. The result, of course, that integration should be there so that it will be easy convincing. The count has increased or motility has increased. That will be easy. So that critical analysis of which dosha is there, and I appreciate the sir's presentation of the structural of the sperm where head, body and tail, Kabam, Pittam and Vadam. That is actually, some of the Ayurvedic fraternities are going in that way. That is a good approach. And this everybody have to think like how we have to break that. That is a critical thing. And along with that, sir has told actually blood in semen actually. Sir has mentioned like actually Charaka has mentioned Dadu Samyogam actually is the presence of or Shuklam mixed with blood. Ashtanga Hridaya has mentioned it very simple like actually Shukla Kshinatla, if the Shuklam is depleted actually, okay, Shuklam Shonidam Evava actually. So because your Shuklam turns into either blood or blood mixed. So we have references for that. And again, normally what we do is, Sir is an expert in that actually, KC man. I'm not an expert, even though from my practical side, I'm thinking like everyone, we approach the case in a Vajigarna way actually. But Vajigarna is what I personally feel is as a limited, say in that actually, because many of the diseases has to be treated Shodhana followed by Rasayanam actually, because there is a Srodhorodham happening there. So if you want to correct that Srodhorodham, what is the reason for the count loss, or what is the reason for a motility loss, or what is the reason for an morphological loss actually? So that has to be corrected by means of either Shodhanam followed by a Rasayana therapy rather than a Vajigarnam. We give all the cases like Ashwagandha Lehyam and count increase. So always we should think about what is actually count loss or lack of liquidity and infertility. Both the things are different actually. So this is my small knowledge what I want to share you. And one more important thing actually many of we people never think is actually this is a direct reference, and one more hidden thing is there because sir has exactly mentioned like usage of kushta in infertility or Shuklagada Rogas and Kogilaksham. I have one more thing to add to that actually. We have missed a point like actually Dadugada Kushtam is mentioned by Acharyas actually. Dadugada Kushtam in Dadus actually. Adile, what happens is when the Kushtam is in Shuklagadam, Sodarya Abatya Badanam, the man or the person suffering with that will end in infertility actually. So Shuklas the Kushtam is one of the reference actually. So now you can think about actually why Acharya has mentioned Kushta in the management of infertility, and again is Kogilaksham. Kogilaksham is a wonderful drug used in the management of actually Vadashonitam. Okay, see Kogilaksham Kashaya Pidata Shagabojina, Kribabhyasa Iva Kroda, Vadraktam Niachiri. In Vadrakta treatment, Acharya has mentioned it. Again, there is a connection between Kushtam and Vadashonidam. That makes it. Okay, see, because in Purvarupam, Acharya has mentioned like Bhavishyada Kushtasamam. In Vadashonidam, Purvarupam, okay, it will be like Kushtasamanam. So if you go deeper, all these drugs like Kushtam, Kogilaksham, all these things actually, it links to, Dadugada Kushtam as well as Vadashonidam. Okay, so we have to think in a wider perspective. I have only limited knowledge regarding it. So thanks for giving an opportunity, sir, because I used to tell the students also, always infertility, you should approach like this also, like sir has highlighted that point also. Thank you very much, sir. Thanks for the opportunity. Thank you all.
Thank you, Dr. Sudhi, for your valuable inputs. I call upon Dr. Namrata and Dr. Ashutosh Pandey onto the stage to felicitate the speaker. I call upon Dr. Madhava Diggavi onto the center of the dais. I request the chair and co-chair to also join the felicitation. Further, I call upon Dr. Vijay Pal, Chairperson of Ayush Expo 2026, to honor our chair and co-chair. Thank you, Dr. Sudhindra, sir. We also thank Dr. Dharmesh for co-chairing the scientific session. Thank you. Thank you, everybody.